Welcome to the second module of the nursing course, Vital Signs and Patient Monitoring. Why vitals matters? A patient may look perfectly fine, but inside the body could be crashing. Vital signs are the early warning system of the human body. If you read them correctly, you can save lives. Vitals don't lie, but nurses sometimes ignore them. Welcome to the second module of the nursing course, Vital Signs and Patient Monitoring. Why vitals matters? A patient may look perfectly fine, but inside the body could be crashing. Vital signs are the early warning system of the human body. If you read them correctly, you can save lives. Vitals don't lie, but nurses sometimes ignore them. Let's discuss about what are vital signs. Vital signs are measurements that indicate the body's basic functions. What are the core vitals? Temperature, pulse, respiration, blood pressure, oxygen saturation. Vitals are like a car dashboard. If warning lights appear, you don't ignore them. Let's discuss about the temperature. Temperature tells us about infection or inflammation. What is the normal range? 36.5 degrees centigrade to 37.5 degrees centigrade. If there is fever, there can be infection. Low temperature, shock or sepsis. Fever is body saying something is wrong. So investigate. Let's talk about the pulse. Pulse reflects the heart rate and rhythm. What is the normal range? 60 to 100 beats per minute. What all key observations you have to make? Rate, rhythm and strength. Pulse is like a drum beat. Regular beat, healthy rhythm. Respiration, one of the other vital sign. Respiration shows how well the body is getting oxygen. What is the normal range? 12 to 20 breaths per minute. What to watch? Fast breathing, labored breathing. If patient is breathing like a running a marathon while resting, then this is a problem. One of the next vital sign you have to measure is blood pressure. Blood pressure is the force of blood against artery wall. What is the normal range? 120/80 millimeter mercury. BP measurement, you have to follow some steps. First, you have to position patient comfortably. Apply BP cuff at heart level. Use stethoscope, inflate cuff, slowly deflate and listen. Common errors: wrong cuff size, talking during measurement. Talking patient, wrong BP reading. Remember that. Let's talk about oxygen saturation. Pulse oximetry measures oxygen in blood. What is the normal range? 95 to 100. If it is below 90, it's danger. Oxygen is fuel. Low fuel, body shuts down. ECG. What is ECG? ECG records the electrical activity of the heart. We use 12 lead ECG for diagnosis. We have to follow proper lead placement, monitor rhythm. ECG is like WhatsApp chat of the heart. Let's talk about some red flags. We have to always act on our abnormal values. What are the danger signs? BP too high or low, SpO2 low, pulse irregular. What actions the nurse have to take? Report immediately to the doctor. Let's discuss a mini case. A patient has SpO2 of 82. Nurse ignores. Patient collapse. What is the lesson? Vitals ignored is equal to danger. In this module, you learned temperature, pulse, respiration, BP, SpO2 and ECG basics. Vitals are not numbers, they are life signals.